Hello everyone. Thank you for watching my YouTube channel MedMD. I am Lauren Winsett, and today we are going to talk about how plant-based diet reverses heart failure symptoms. Heart failure used to be considered a one-way street toward infirmity, chronic illness, and ultimately death, in half of the cases, within 5 years. But a new study published this week shows that a plant-based diet can dramatically improve outcomes and even reverse symptoms in cases of heart failure, which is encouraging to say the least. In the past, plant-based diets have been shown to improve the health of patients with heart disease, but this new research showed it can also improve the outcomes of patients with heart failure, by increasing blood flow, strengthening the heart's ability to pump blood to the body and allowing patients to be more active, while lessening the effects obesity, hyperlipidemia, hypertension, and diabetes. The study, first published in Korea, explains that plant-based diets have a positive effect even in patients suffering from advanced-stage heart failure, often defined as the inability of the heart to pump adequate blood to the body that it needs to function. Heart failure is one of the most common causes of morbidity and mortality in the world, the study authors write. The disease prevalence is more than 5.5 million in the U.S. alone and 23 million globally, the authors Faris A. Alasmer and Hammam A. Alataibi point out. Annually, more than 550,000 people are diagnosed with heart failure in the U.S., and half of them die within the first 5 years, the authors report. That's where intervention with a plant-based diet can make a difference. The authors looked back at data from studies from the year 2000 through March 2020 and focused in on those patients with heart failure and risk factors for it. They then cross-checked patients who followed a diet that was either vegetarian, vegan, plant-based diet, and identified 3 studies used plant-based diets as interventions, and the results in all 3 studies reviewed were dramatic. A number of small studies in the past 2 decades show a consistent positive clinical and risk factor improvements in patients with heart failure, the study's authors concluded. These findings, although in small samples, can lead the way for more interventional studies with more rigorous design to shed more light on the effects of a plant-based diet on heart failure as a clinical intervention. The studies were a small base of 50 patients, and review studies are not considered as reliable as clinical trials, but the evidence all points to the fact that plant-based diets can lead to dramatic and measurable improvements among cardiac patients experiencing heart failure.